Hello, ladies and gentlemen. It's my great pleasure to present to you some aspects of orbital surgery in Iraq and to tell you what's been happening over the past decades and also what's going on now and what's our hope for the future. As everybody knows, surgery of the orbit is the land of many specialties which surround the orbit, namely the neurosurgery, ophthalmic surgery, ear, nose, and throat surgery, maxillofacial surgery, reconstructive surgery, and other related subspecialties, including medicine and endocrine medicine, specifically thyroid endocrine problems, and also skin diseases. So orbital surgery is really an area of a teamwork of specialists related to that area, that part, and it also represents a real subspecialty work where many specialties they pour in together their experience to get the best to help the patient in his problem. Surgery of the orbit started in our country in the 50s with the pioneer surgeon, general surgeon, Professor Hussein Talib, who was a really very courageous surgeon who went into many fields. At that time, it was not an easy thing, easy task to take, but he has taken this task added to his general surgical tasks. I started orbital surgery based on my knowledge and experience, a very modest experience in ophthalmic surgery prior to my coming to neurosurgery, and that took about 2.5 years working in eye surgery in Iraq and also in Britain, Manchester and Dundee. We started orbital services in the 70s and 80s, starting at Ibn al-Haytham Hospital, which is a specialized ophthalmic hospital in Baghdad, and then moved to our hospital now, which is Al-Shaheed Adnan Khairallah Surgical Specialties Hospital, which is a teaching hospital to the medical school at the University of Baghdad. The center of orbital surgery proper has been started in 9th of May this year, 2002, based in the 14th floor of the Al-Shaheed Adnan Hospital, and it harbors 16 beds. Patients are referred to this center from all over the country, and it has computer service. The case sheet is on a computer and the operation notes are on a computer, and there is a computer network between the different places, including theater and the outpatient department and the wards, and there is also an information center which has a good specialized library and CD library as well. An internet service is available for everybody to use, of course. To my knowledge, there is no center like this specialized in orbital surgery in the Arab world. There are many specialists, of course, distinguished specialists who work in this field, but they are not in a center geared for orbital surgery only. They work in within departments other than so-called orbital department. Again, in the whole world, there are not many specialized centers geared only for orbital surgery. We do, of course, in this department or this center, we do surgery of the orbit, and also we do craniofacial surgeries, including hypertelorism and congenital anomalies of the skull and the face and the orbit, which the teamwork really is required in this area. We hope this will be a model to other specialties to work and to enlarge their knowledge and experience in a small field, taking the advantage and experience of many specialties related to that very small field. You are going to see some highlights of our work, starting with introductory talk about orbital surgery, the nature of the orbital surgery, and the specialists and specialties related. And then you will see a sample of surgeries being done before and after surgery, how they were and how they are after surgery. And in the third section, you will see videotapes of some of the surgeries. One of them is surgery of removing a huge tumor transconjunctivally. And then you a new surgery which is designed by the author in the center, dealing with orbital hydatid, which has not been mentioned in the books before. I hope this seed will grasp your interest and you will find it useful to see first about orbital surgery, and second what's been done in Iraq in the orbital services and in the orbital center. Thank you very much.